Hello, we are the co-moderators of the cardio-oncology session here at BCVS, and we had 4 great talks today. But first, to introduce ourselves, my name is Han Zhu from Stanford, and I'm joined here by my wonderful co-moderator, Dr. Doug Sawyer. So this cardio-oncology session was a great selection of different topics across the field of cardio-oncology in terms of looking into mechanisms of various cardiotoxicities from different agents, spanning from anthracycline cardiotoxicity to cardiac metabolism and its relation to cancer, as well as immune checkpoint inhibitor cardiotoxicity, not just myocarditis, but as well as atherosclerosis, and last but not least, ponatinib-induced cardiotoxicity. And so with that, we'd like to give everyone a little bit of a summary into each of the talks. So the first talk was given by Dr. Arthi Asnani from Beth Israel Deaconess Medical Center. And her work focuses on anthracycline cardiotoxicity. As you know, anthracyclines are a group of chemotherapies that are used to treat a variety of different types of cancers, and they're known to cause cardiomyopathy. And so with Dr. Asnani's work, her work spanned across a lot of different models, from zebrafish to mouse to human. And she gave a beautiful talk with 2 storylines. So one was about the role of CYP1 enzyme inhibition in protecting the heart against doxorubicin-induced cardiotoxicity. And with that, she talked about essentially diving into the mechanism of this particular pathway and how it could be used as a therapeutic target in reducing cardiotoxicity in patients receiving these chemotherapies. In another story, she actually talked about going back to the patient and recruiting patients and drawing blood from patients and looking at specific biomarkers of cardiotoxicity and trying to predict who might be at risk for anthracycline-induced cardiotoxicity. And in that, she talked about a particular biomarker, hemopexin, which is an iron-binding protein, and how that could be a biomarker of cardiotoxicity, and how this particular protein may also play a role in the mechanism of cardioprotection.
Yeah, the second study was really wonderful work presented by Dr. Vlad Zaha at the University of Texas Southwestern Medical School, who's developing some really elegant imaging methods that help us understand what happens to cardiac and other organ metabolism in the setting of cancer therapy, but potentially also many other cardiovascular illness and physiologic settings. The method is using hyperpolarized carbon, a C13 labeled carbon that normally can't be detected in MRI, but through a sequence of steps, he and his colleagues have shown that it becomes detectable in a clinical setting. And he went on to demonstrate in that context of cancer treated patients that they could detect changes in metabolism that are known to take place with changes in the way our hearts metabolize carbon and sources of energy. And it was really an elegant presentation with real implications for potential applications in other settings, as I mentioned.
So the third talk was given by Dr. Tom Nealon at MGH, and he gave a wonderful overview of the field as it stands of immune checkpoint inhibitor cardiotoxicity, ranging from myocarditis to accelerated atherosclerosis. In the first part of the talk, he focused on myocarditis and our current understanding of the mechanism of ICI-induced myocarditis, which is an entity with a significant case fatality rate of up to 40%, which is much higher actually than viral myocarditis. And so he discussed the clinical significance of this entity as well as our current understanding using mouse models and existing work into the mechanism of this disease. In the second part of the talk, he focused on accelerated atherosclerosis as a consequence of treatment by ICI immune checkpoint inhibitors, and really spanned across a variety of different immune mechanisms of even garden variety atherosclerosis and essentially delved into some of the existing mechanistic work that could potentially even transform our understanding of the immune origin of atherosclerosis.
The final talk of the session was by a young investigator that's been supported by the American Heart Association through a Career Development Award, Dr. Tusif Sultan, who is at the University of Alabama, and he presented some work by him and his colleagues on looking at understanding the mechanism by which ponatinib, a tyrosine kinase inhibitor, induces cardiac dysfunction. Really elegant studies were presented in mice primarily that showed that the ponatinib in the setting of some metabolic stress can induce a profound inflammatory response involving what's known as the inflammasome. This has some real implications for how that might be prevented in a clinical setting, and I look forward to hearing future research all along those lines. Well, I hope you can see that there's some really exciting work going on in the field of cardio-oncology, and this is really important for the American Heart Association's support. Cardiovascular complications of cancer persist, and we need to find ways to help people prevent cardiovascular disease during cancer treatment, but also restore wellness after that treatment. And we're very excited about what we've seen today. Dr. Zhu?
That's right. And so there's actually a great need for mechanistic work in this area. And what we saw today is really a great beginning into that, and really finding targeted and personalized therapies to prevent and treat these cardiotoxicities, and really give patients and providers confidence that they can provide cancer therapy safely and be able to protect the heart throughout the process.